I'm the first negative, and I'm against the U.S. adopting a government-paid healthcare. My first claim is that government-run healthcare will bankrupt the U.S. Taxes will not be enough to sustain government-run healthcare. Brian Crowley of the Heritage Foundation says that this is a Canadian example. That's the closest example to a system that's in place right now. That Medicare as we know it can only be sustainable if Canadians are willing to accept less service or more taxes, and given increasing consumer expectations for expensive health technologies, drugs, and procedures, the expected health demands from an aging population, Medicare's problems are only going to grow. In fact, a paper by Bill Robinson, the Vice President of the C.D. Howe Institute, argued that liability of Medicare is in the $500 billion to $1.2 trillion range, and that is, and Canada's entire national debt is $530 billion. My second point on that is that government-run healthcare costs are too high. A recent poll by Decima Research found that more than half, or 55% of Canadians were opposed to paying higher personal income taxes. And if these funds were designated to pay for health care, or if those were designated to pay for health care, and 67% believe that they would have to rely on their own personal savings to pay for their health care because the costs were going too high. My second claim is that the current healthcare system is sufficient, and that minor fixes can be done to the current system to fix it. The Kaiser Family Foundation said on March 23, 2010, President Obama signed into law comprehensive health reform legislation and the Patient Protection and Affordable Care Act. And this is supposed to put in new laws and changes that will create legislation to include provisions to expand coverage, control healthcare costs, improve healthcare delivery, and improve the healthcare delivery system. The current system is within our budget, and the Medicare, Medicaid, and the Children's Health Insurance Program, or CHIP, will together account for 21% of the budget, so we can't really go beyond that. Another point is the doctor-patient ratio right now is better than government-paid healthcare, as the example of Canada. The U.S.'s doctor-patient ratio is 390 to 1, and Canada's is 470 to 1, so you might get better quality of care, and you certainly get faster care. My third point is that government-run programs in the current system are not very efficient. The government programs will be mismanaged. According to Brian Crowley, the Heritage Foundation, said that the system in which healthcare services are free at the point of consumption, queuing or creating a list of who gets service first, is the most common form of rationing scarce medical resources. And the patient satisfaction plays no part in determining incomes or other economic rewards for healthcare providers, and administrators of the public system, patients' time is treated as there's no value to it. My fourth claim is that healthcare quality will be significantly lower. One point on that is that there will be much longer wait for care. According to Lawrence Reed of the Mechanic Center for Public Policy, an estimated 900,000 Canadians were on hospital waiting lists for surgical procedures in 1998, and the average total waiting time of 13.3 weeks was up from 11.9 weeks in 1997, and a shocking 43% up since 1993. And my final point is there will be less incentive for good doctors to get into medicine and stay in medicine. Government-run jobs pay less than private practices, and on average, private practices have the opportunity to expand, get their patients in and out faster, and can focus on a specialty, which will bring in more money than a government-run clinic.